Okay, we're going to do part one from this book right here, Prevent and Reverse Kidney Disease by me, Pete Rogers. I like the painting on the cover, Niagara Falls by Frederick Edwin Church. Okay, here's the table of contents. Frequently asked questions for kidney disease. Then we're going to talk about low and very low protein diets. That's like the most important thing you can know about to protect the kidneys. We'll talk later on how to prevent kidney stones, atherosclerosis, hypertension, diabetes, autoimmune disease. Okay, disclaimer, this is just for educational purposes. I'm not your doctor. This is not telehealth. This is just educational. Your blood pressure and your blood glucose are going to drop like a rock. Your anticoagulations could change. So work everything out with your doctor. Titrate your medicines. And I said here, I'm not your doctor. I'm just an autistic genius who spends all his vacation time writing books as a substitute for having no social life. If there's any low-life language in this book, it's my ex-wife's fault for pissing me off. It's effing ridiculous. Here's a quote from an internal medicine doctor. It's effing ridiculous that Kempner had better results treating hypertension, diabetes, and kidney patients in the 1940s and 1950s than we do today, 60 years later. Yes, that is correct. Okay. All right, time for kidney FAQs. So the first is, what is the main point of the book? It's that, most kidney patients, they go right to dialysis. Nobody ever teaches them anything about nutrition. They just crash and burn, and then they die pretty fast on dialysis. That's a typical kidney patient. And it's usually the patient's own fault for being an ignoramus. Sometimes it's bad luck. They'll get some weird, rare autoimmune disease. But the vast majority of the time, they eat a lousy diet. It's because of diabetes and hypertension. And they just go into kidney failure. Those are dietary diseases. Fix your diet. You can fix those diseases if you catch them early enough. This book will empower you to know how to prevent those diseases. It's pretty well known what causes obesity, hypertension, diabetes, atherosclerosis, and a lot of the common toxins. Okay, so now we got to get into what is the definition of chronic kidney disease. We're going to talk about GFR, glomerular filtration rate. And it's basically like the percentage of kidney function. When you're first born, you start out with a GFR of around 100. Okay, and that means you got about 1 million nephrons per kidney. Okay, so you can just sort of multiply up from 100 to 1 million. Stage 1 kidney disease is when, you're still over 90, so you're in pretty good shape. All right, but there's been some kidney damage. Stage 2 is a mild loss of function. That's when you're above 60. So these people can do pretty well. They can do very well. Especially if they get their act together, they're less likely to progress. Stage 3 is where trouble happens. The alarm bells go off when you hit stage 3. You get a GFR below 60. Because now you're headed towards dialysis. And these patients tend to progress on to dialysis. So you want to turn things around as best you can. Okay? So if you're stage 3A, that means you're 45 and up, 45 to 60. So you have at least 450,000 nephrons in each kidney. Stage 3B is when you drop below 45. You're 30 to 44. And then you got at least 300,000 nephrons. And now when you drop below 30, man, it's emergency. It's DEFCON 7 or whatever the highest one is, all right? Now that patient is almost inevitably, once they get below 30, going to end up on dialysis. So you have to pull out all the stops, do every possible thing. I recommend you do every possible thing. The sooner the better. By the time as soon as you hit 60, if not before then, to prevent yourself from ever dropping to 60, okay? Most people, in my experience, don't understand how sick they are. They don't get it. They're thinking something like, I'm not as fat and sick and stupid as my cousin. But that's not the standard. The standard should be, am I doing the best I could possibly do? Okay, so you need to know GFR. That's a lab you have to know. Everybody's going to talk about that the rest of your life. Usually when the patient's GFR drops below 15, that's when they go on dialysis, right around there. Okay? So it's called percent of function because, like I said, 100 is totally normal. 90 is about 90% kidney function. 60 is about 60% kidney function. Okay. And here's just a picture where we're playing chess with depth. Okay. And you can get a transplant, but it's much better to just save your kidneys by eating a healthy diet. Okay, what are predictors of who ends up on dialysis? Well, if anybody's eating a high-fat, high-sodium diet, a lot of animal foods, are more likely to end up on dialysis because those are the foods that cause hypertension and diabetes. Okay, if their GFR is low, below 30, they're already 3/4 screwed. So they better, like I said, do everything possible. You cannot take any chances. Okay, if they got more albumin in their urine, that's a sign of bad kidney failure. If their serum albumin is low, that's bad. Hypertension, diabetes, atherosclerosis, if they're acidotic, smoke cigarettes, drink alcohol, they're sedentary, sleep deprived, all of those things, note these are almost all totally controllable, and they're all major risk factors for kidney failure, progression of CKD. CKD is chronic kidney disease. Okay, what are the main causes of CKD? We just talked about them: obesity, hypertension, diabetes, atherosclerosis, due to high fat, high protein, high sodium diets. That's why you don't want that. And if you catch them early, fix the diet. Hypertension and diabetes, usually diabetes type 2, they're 100% curable. Typically low fat, low sodium, vegan diet, organic only, whole foods. Okay. Atherosclerosis can also cause chronic kidney disease, but the point's moot because atherosclerosis is mostly caused by hypertension and diabetes. And the things that cause them tend to cause a lot of the other problems like leaky gut associated with autoimmune disease. Okay, so we'll stop there. We're going to start up next time on what else can cause CKD. Hope you found that helpful.